This is Dr. Suresh from Continental Hospital, Hyderabad. How are you?
Good evening, Dr. Suresh. Samina here.
Hi.
Yeah. So we will be getting started in another 1 or 2 minutes max, Doctor. Some more people are joining us in.
Sure.
Okay. So good evening and welcome everybody. I'm Samina Kausar, the CEO for Ethica Work Life, the organization that's bringing you multiple well-being events every single month to ensure your 360-degree well-being. Today is no different. We have a very, very special event lined up for you. The 2020 research of WHO says that 1 in 10 Indians will develop cancer in their lifetime. But this is not something to scare you. I want to tell you that there is a good news also. It also says, the report also says that many of these cases are also preventable, which means we can do a lot to protect ourselves and stay in the healthy 9. In this World Cancer Awareness Month, let's recognize that the commitment to act will lead to powerful progress in reducing our risk of cancer. By acting today, we can make a lot of difference to our health and help in keeping cancer at bay. To do this, I have an expert with me, Dr. AVS Suresh. Welcome, Dr. Suresh. Welcome to the session, and we really appreciate you being with us. I'm looking forward to a lot of insights from you that will help us prevent cancer. Of course, I'd like to tell something about Dr. Suresh before we proceed. Dr. AVS Suresh is a physician scientist, an academician also, and an inventor as well. He has deep roots in research and science. He has over 2 decades of clinical experience, has performed thousands of surgeries and has done many transplants as well. He was a principal investigator for over 200 clinical research projects. With over 300 publications, he is also on the editorial board of international journals. That's a very illustrious profile, Dr. Suresh. It's a great pleasure with which I'm welcoming you to the session. Please take it over.
Thank you very much. You have to excuse me for my bad voice because I have a small sore throat. If at all it is not audible clearly, you please stop me and I will be happy to repeat the things.
Sure, doctor. Thank you so much. No problem. Thank you.
So today's topic is cancer, where we stand in 2021. The stage is perfectly set by Samina. Thanks for that. This is the first slide that I always would like to start my presentation with. What is common with among these things? People will be spot on in telling that these are all cancer survivors. But I have something more to add, which you people may not be knowing. They are all stage 4 cancer patients who were otherwise written off with a limited lifespan. They not only conquered the cancer, but they resumed their career. That's the beauty of this. That means cancer treatment is no more crippling. So don't worry if at all the bad C hits any of the nearby people. So what is this cancer, the bad C? It is abnormal, uncontrolled cell division. So it's like a vehicle without brakes. That means there is no control. And it's going in the wrong direction, maybe down the hill or towards the valley. So what is bound to happen? It's going to crash. It's not going to crash normally, but it is going to crash the organ in which it develops. So why it happens is it's damage to the genes. So let me explain to you. All of us will be knowing that we have a set of 23 genes coming from the mother, 23 from the father, with XY, which is going to determine anybody's gender. That's exactly what happens. So each cancer happens because of lack of control. I want to give an analogy. If your handbrake fails, then you put your leg brake. If your leg brake fails, you put your handbrake. Right? If both fails, then still you can put the vehicle into a neutral and then just let it stop by itself. Or gear and then just take out the clutch if it is a geared vehicle. So you have 4-5 different ways on handling the vehicle. Similarly, body also have mechanisms on how to stop and prevent this cancer, right? I'll explain to you in detail. If you have some knowledge of mathematics, I'll give an analogy. There are 10 to the power of 15 gene pairs are there, or DNA pairs are there in each chromosome. You have 23 chromosomes. You have 10 GB cells are available with us. Just a minute. Hello? Right? So these cells, by virtue of, I can say, ability to, I'm sorry, just a minute. I got a small distraction. Just let me attend the call. Hello? Sorry, that was a call. Right. So, where I was, yeah. So, you have trillions of genes which have to be replicated exactly in the same way. And every day, close to 1 trillion cells have to divide. So, imagine trillion divisions have to happen without error. So, that cannot happen. So, you see some mutations, some errors. So, these errors will ultimately lead to a cancer cells. So, on an average, each and every body is having 30 to 40,000 cancer cells every day. So then how we are going to survive without cancer? We are surviving because our immunity is strong. Our immunity is designed in such a way that any cell that doesn't belong to you, it can be a bacteria, virus, fungi, or cancer cell, doesn't matter. They don't have the inherent capacity to identify themselves as self. So there is a group of cells called natural killer cells which identify and kill these cancers. The moment the cancer becomes Behrupi or it mimics a normal cell, it escapes the immunity so that immunity cannot neutralize it. So when there is an increased production of cancer because of the lack of the genes that will put brakes on the cell growth, or whenever the immunity fails to control it, then only cancer cell happens. That's why I always say, keep your immunity up, ensure that you don't invite the extra troubles, because these breaks are easily spoiled by smoking and other habits. They divide rapidly, they invade the surrounding cells. That's how. So the people use the word tumor with the cancer interchangeably, but not all tumors are cancers. Those tumors which have a potential for metastasis or ability to go to the other organs are called cancers. Right? When cancer happens, what do you want? You want a total cure. So to achieve a total cure, you need to destroy all the cancer cells. Is it possible? No. One cancer cell is enough to restart the entire process. If I mathematically extrapolate, I cured you, I did a surgery, I did a radiotherapy, I gave chemotherapy. Let us assume one cancer cell is left behind. It takes 5 years for that cancer cell to manifest itself again. So you call technically a zero cancer on PET scan or any other scans as remission. You call cure if at all the cancer doesn't recur after 5 years. That's what are the true definitions of the cancer cure. So again, to bring you back how the cancer signals with each other, this is how it goes exactly, right? It's a very complex biomolecular network that leads to it. So these numbers were already told by Samina. So just to recapitulate, 14 million people any given day are suffering with cancer, and almost half of them die because of it. In India, we have almost 1/10 of those cases. Our death rates are slightly higher than the world. Why it happens? This happens because of this particular phenomena. So if you look at the population, India is having close to billion population, 1.3 billion population. We have almost 30% who are at risk. and 10% of them are underdiagnosed. Few of them are controlled or uncontrolled, few of them will be diagnosed and cured. So because of the gross discrepancy that we face between early diagnosis and the treatment, we have relatively higher deaths. But if you look at the burden wise, we have the least burden. You look, the developed nations are reddish to orangish compared to India and few of the other South African nations where the incidence of cancer is quite low, and we maintain well here also. So overall, if you look at the statistics, India is in a very good position. This is the statistics as of 2017 December. So why cancer happens is, as I told you, one break is from genes. So that means you have some problem. The second break is your habits. So there's a famous saying, genetics load the gun and lifestyle pulls the trigger. That's how the cancer happens. So if you don't pull the trigger, then bad genes also are harmless. If you want a spectrum of what causes cancer, then starting from, I can say, food, which is 35% cause as of today, to tobacco, to alcohol. So close to 70% of today's cancers are preventable, 70 to 80%. You take bad diet, you have a lot of free radicals, you develop cancer. You take tobacco, any form, smoking, eating, or snuffing, it causes cancer. Sunlight, fortunately not in India. Alcohol is, again, one of the reasons for the cancer. But what can be prevented is, for viruses, I can give vaccine. I can improve my food. I can avoid tobacco. I can take care of the alcoholism. That is 35 plus 30, 65 plus 3, 68 plus 7. So 75 plus 10, that is 85% of the cancers are preventable. So this 1% is likely to become 10% in next 5 years. You know, what is that radiation? So, okay, let me invite you to do a small exercise here. So, Meena, you can unmute yourself and then just can get back to me. Those who are having mobiles can pick up their mobiles and type *#07# and get back to me what is that number. *#07#. I will be looking at your chat boxes. Can you hear me? Am I audible or I lost?
You're audible.
Yeah. Something went wrong. Oh, got it. So someone put that head SAR is 1.28. That's dangerous. Someone else put it is 0.87. That is acceptable. I would like to see this. I would like to explain before I get all the other answers. That means for every kg of the tissue, the moment you put your cell phone, 1.2 watts of energy is transferred to your tissues. That is going to damage the DNA. Then it is going to increase. If you can recollect the movie Robo 2, that's what I mean. That's the exaggeration of the things, but that's not very far from the facts. People speak a lot on the phones. So there is a lot of energy transfer that happens between the cell phone and the tissue in and around the brain that is potentially damaging. That's exactly what is more dangerous. If the person with a SAR of 1.28, you can't speak more than 6 minutes. 0.87 probably can speak with 10 minutes. So that's how it goes. The lower the SAR, the better is a cell phone. So choose a phone by not its features, but by its SAR. The more expensive ones have a very low SAR. Am I clear? There is one thing that you can always do to yourself. So coming back, to the types of cancers caused by the tobacco. A whole list is there. So as the alcohol, but the list is smaller than tobacco. So what should alert you to seek a medical advice is change in the voice, like what I'm having now, ulcer in the tongue and mouth, cough in the sputum, unusual change in the size and shape of the breast, or lumpiness or change in the skin color, change in the bladder bowel habits, or excess urination, which is reddish in color, breathlessness, difficulty in swallowing. A whole list is there. If you feel any of them is there, then ask this question, do you have cancer? Most of the times I have answered, don't tell me. That's not the right thing. It can be yes, no, but it is always good to get yourself screened. So what are the cancers that we screen? Why do we screen? Screening is done to detect the cancer early and to cure more patients. In women, we recommend mammogram between 50 to 74 years. In India, 40 is the age. At least one pap smear for all the women after 21 years of age. Lung cancer, one X-ray. Colon cancer, stool for rectal blood and colonoscopy. After the age of 50, prostate cancer therapy is a very easy thing to do. This is a point called critical point. If you start treatment after the critical point, you don't have much of cures. So if the critical point is here, that is preclinical stage of the disease, it's always worth doing a screening for all the cancer cells. Is it always painful? No. You have advanced testings like, look at this woman. She put a small light under her breast, and this light has highlighted a shadow, a blackish one. This is a tumor. So a ones which cannot be comfortably palpated, which are deep-seated with the bare hand, can be, I can say it is going to make them seen. You people know exactly, right? We put torchlight under our hand and then try to see the veins that were in our olden days when we used to play. But a similar thing, but having a specific wavelength, is called breast light. A very expensive tool, 2,000 rupees. Every woman can afford it to test themselves once in a month. You have capsule endoscopies. I don't put a tube into your mouth, but rather I will ask you to swallow a capsule and take it out, just like how you fetch a pail of water from the well. So while coming out, these bristles, that is brush-like things, will catch up the cancer cells if they are there. You have a mobile-based VIA, and you have urine assays for the cells. So whenever cancer comes, then what to do? You need to treat it, either with surgery, chemotherapy, radiotherapy, target therapy, hormone therapy, immunotherapy. So things are quite advanced. They are not as toxic as they were. So we have liquid biopsy. I can diagnose cancer without biopsy by taking 2 ml of blood. Technology is available. You have low-cost NGS. I hit this. I exactly know to what chemotherapy cancer is going to respond. So there is no more trial and errors. So a lot of advancements were made. So a small PET scan with a liquid biopsy may be an answer for the future. I need not go for biopsies and other things. You have NGS available with us, which tells what is the propensity for developing cancer in the next generation as well. Right? You have some personalized therapy. And immunotherapy, which I told you, by boosting the immunity, I'm curing the cancer. I'm not touching the cancer, I'm not touching the pathways. Just improve your immunity and cure the cancer. You have new technologies called hyperthermic intraperitoneal chemotherapy for most of the abdominal cancer, which is almost 3 times better cure rates than other things. You have medicines for the nausea, vomiting. You have medicines for the bone metastasis. You have wonderful pain management protocols, and the cancer nutrition is coming in a big way. Food actually prevents cancer, and it reduces the cancer treatment side effects as well. Only thing is you need to be meticulous and focus yourself on these things. So with these things, with a very positive note, I would like to draw to your attention to the last slide. 4 in 10 cancers are preventable. There is a hope. There is a cure for every ribbon that you are seeing here. Hope for the best, and I open the floor for any questions that you may have. I mean, understandable or it's completely bouncer? No questions?
Doctor, I had one question.
Go
So,
ahead, please.
yes, so I have my family, which has always had cancer history, where, my paternal side has frequently been diagnosed with cancer, different parts of cancer, like, not really one specific type. So, my dad was diagnosed with lung cancer, um, aunt with lung fibrosis, but not really cancerous. I think my other aunt was diagnosed with breast cancer, and my cousin died with esophagus cancer. So, is this like a genetic
Yes.
trend?
What you're telling is pointing towards a potential genetic thing and hereditary thing. So the ideal thing in this case is, if at all any of these survivors are there from the cancer who are living, you get a test called germline 6.
Yeah, we
Right? There are,
couldn't do that. By the time we got to know about that test, my father passed away, and we don't have anybody else who survived through.
oh,
So,
okay. So
right.
probably you can get yourself a test called, again, germline 6 with extension panel. There are 56 cancers which you can detect it early by help of genes, and you can prevent them by offering surgery or some treatment. So there is a genetic counselor that will help you in making a decision. So you can come down at any point of time. We can just help you in getting the test done. It will take 21 days to analyze the entire gene panel and see whether you are at risk of developing any future hereditary cancer from your parents to yourself, sort of thing. That's possible.
All right.
Does
What
it
is the
answer your
test?
question?
Can you tell me? Yes, it does.
Thank
Can you
you.
just help me with the test name again?
It's called germline 6.
Germinal and 6. All right.
Okay.
Thank you.
So what is the targeted chemotherapy? Yeah, targeted therapy is something where I don't touch the normal cell but kill the cancer cell alone by selectively picking it up. And I need to understand the genetic makeup of the cancer. 50% of the cancers are targetable, 50% are not. So for the 50% where I can target, I try to avoid chemo or minimize the chemo. Where I can target, where I can't target, I go for the chemo. Right? Does it answer your question? Perfect. Is cervical cancer stage 3 is curable? Yes, why not? If you give chemoradiotherapy, quite curable. Most welcome.
Hello, sir.
Yeah.
For my mother, in PET scan, at present, no issues. It indicates that in future also possibility is there to come recurring of that cancer. She
What
has
type
breast
of
cancer
cancer it
stage,
is?
breast cancer stage 2.
After 5 years,
4 years of
practically, we write it off as there is no chance of recurrence. If anything comes after 5 years, should be a new cancer, but you have to be under continuous follow-up for a period of 5 years. If it is stage 2 cancer, the possibility of recurrence is around 5 to 8%. So nothing much to be worried about it. Quite curable.
if it is for starting, sir?
Starting stage 4 is quite bad. Quite bad. Then you need to check what type of biology it is. If it is good biology, probably for a few years we can make her live in more comfortable manner. But if it is a bad biology, no, I mean, that's not very comfortable thing.
After stage 4 identification of 2 years in PET scan, now no issues.
That's a great thing to hear. So
Okay.
that means the patient achieved a complete remission with what that means. That's exactly what I was referring to. The biology of the disease must be good. So for good biology disease, we expect good amount of life.
Okay, thank you, sir.